So I've been interested in it for a while. There is a fellow named Norm Shealy who is still alive, very famous neurosurgeon, and then one of the early people in the holistic medical movement, who used transcranial stimulation to treat chronic pain and demonstrated that you could, in those people, raise DHEA levels. DHEA is a pro-hormone made by our bodies, and when we're pre-adolescent and before we start our adrenarche or menarche, start making a lot of sex hormones. And if you can recall that far back, you do that. You remember how great you felt in that time of your innocence. Those levels were the highest. And he was able to note that when he could raise DHEA, there was a reduction in pain and depression. And there's a fellow named Saul Liss who had this brain stimulator, which I once bought and lost. And so then I started looking around for something like that again. And I came across this Nexalin, which is one of many transcranial technologies. Next. So there is laboratory and clinical evidence that suggests that transcutaneous direct current stimulation, Nexalin is the gadget I have, affects the hypothalamus and related brain structures to adapt and change the levels of neurochemicals, including neuropeptides, neurotransmitters, and neuromodulators. Of course, these studies are done in Russia, where you can get away with doing lumbar punctures on people and cisternal punctures. But in fact, there are decent studies. Next. And the data support that the transcranial direct stimulation technologies result in endocrine outputs moving toward normalization, specifically those coming from the hypothalamic nuclei and associated brain structures. And Kerry was talking about the HPA axis and trying to optimize function, homeostasis, if you would. This is yet another way to try to accomplish this. Next.
So you use this in your practice?
We're beginning to, yeah. And a key indicator of this is a significant clinical change in the levels of beta endorphins and enkephalins in the cerebral spinal fluid of Nexalin-treated subjects, as well as other neurochemicals like serotonin. And the change in these neurochemicals is also apparent based on the response in the patients. Next. And the hypothalamus's main function is to maintain equilibrium, homeostasis. In order to perform this function, it is constantly sensing and adapting to information received by the brain. And the brain's getting it from somewhere. It's getting it from your sensory organs, etc., but also from input from the autonomic nervous system about how the peripheral organs are functioning, etc. Next. So by nature, the hypothalamus is sensitive and responsive to stimuli, and many disorders, including depression, anxiety, and insomnia, are believed to be a result of a decrease in the production of specific neurochemicals or abnormalities in the balance of the neurochemicals. Next. And the pharmaceutical therapies act by replacing these neurochemicals or improving their effectiveness on the receptors. Nexalin therapy works by permitting your body to manage the production of these neurochemicals on its own. Next. It has FDA approval for treatment of depression, anxiety, and insomnia. Next. And additional studies have shown benefit for chronic pain and PTSD. And anecdotal reports show benefit in mild cognitive impairment, Parkinson's, and other mood disorders. I say anecdotal because there are only reports of incidences and not well-controlled studies. Next. Oh, back up. So this, in my mind, the therapy is done over a period of 2 to 3 weeks. And the person sits in a quiet room. There is one broad electrode applied across the forehead and one electrode applied to each mastoid process behind the ear. It's a 45-minute session. Most people don't feel anything. And you do it Monday through Friday for 2 or 3 weeks. It's supposed to reset the brain, and it's supposed to then, in my mind, allow an enhanced benefit from the other important things that you should be doing, such as the behavioral changes, the dietary changes, the exercise. It's not a, excuse for or a way to get away from anything. It's not a reason not to take appropriate psychiatric medicines by a good psychiatrist if you need them. But it is, I think, an effective adjunct to therapies and something that we're introducing and working towards. When appropriate, the herbal therapies can augment these effects. Other nutritional therapies can augment these effects. Next. These are just some other nutritional supplements that you can use, but they're really, to me, not terribly different than drugs, and so are still not an excuse for not doing the other things we've spoken of, the behavioral change, the dietary change, the gentle exercise, etc. But they can be applied, and for some people can be effective. My own experience is that they're, like drugs, best done intermittently and on occasion. And go ahead, next. Theanine is one that's really a nice, gentle one we've used for people and can be a good sort of product that you can get at the end of the day and use with great safety. And I think is quite safe to use for sustained times, although my experience is people still need to do these other things. And the magnesium supplementation can be very good because it relaxes muscle. And so in people who have some, cramping or restlessness, supplementation with magnesium can often be very nice to help them relax, and do better. People with constipation often benefit a great deal. Next. Melatonin is very effective for this, acute disorder for moving time zones. But my experience, and I think most people's experience, is it's not a long-term sleeping pill effect. So that if you say, look, I'm going to try to start going to bed at 9:30 or 10 o'clock, and you've been going to bed at 12 o'clock, you could use melatonin to help that for the first 3 or 4 nights, but you also have to keep the lights dim and be quiet and all of these wonderful additional things. But it's a good tool. And for some of the women in that perimenopausal time and even later, the progesterone can be an effective help in quieting things down a little bit. And many women use over-the-counter progesterone cream at night with some benefit. Some women need higher doses, but it is basically safe for most people.